Good afternoon, everyone. Welcome to my Friday message, 5 minutes of news you can use. I want to begin by recognizing our emergency department colleagues for their courageous actions during last weekend's tragic events in the ED, when most unfortunately, a patient in police custody was fatally shot. We mourn this loss of life. Our providers, house staff, and ED staff acted selflessly to care for the injured patient and help and protect our patients, families, and each other. This crisis came at a time of record high hospitalizations at Duke for patients with COVID, and all of our staff and providers in our health system continue to provide extraordinary care during this most challenging time. Thank you for your steadfast commitment to caring for our patients and serving others. In just a few weeks, we'll have the opportunity to see and hear about the amazing research in our School of Medicine faculty, students, and trainees, as well as our colleagues across campus. Don't miss Research Week 2020, beginning January 31st and running through February 4th. The School of Medicine is proud to co-host this week-long celebration with Duke Office for Research and Innovation. During this star-studded week, you'll hear from Duke's exceptional researchers talking about a broad array of topics, including health disparities, vaccine development, and women's reproductive health. We are so pleased to welcome two outstanding guest lecturers, Dr. Bonnie Bassler and Dr. Huda Zogby, this year's distinguished Robert J. Lefkowitz Lecture. See the full lineup of speakers and register to attend at dukeresearchweek.vfairs.com. Now let me share some of the latest COVID news. It looks like some communities, particularly with large urban settings, have hit a plateau in cases, and some states, particularly the Northeast, are actually experiencing a downward trend in cases and hospitalizations. This is not yet the case in the country as a whole, with over 850,000 cases per day, and in North Carolina, where cases and hospitalizations are still increasing and exceed earlier points in the pandemic. In North Carolina, the test positivity rate is 30.7. On January 19th, there were over 17,300 new cases, and on the 18th, over 4,600 hospitalizations. Modeling suggests that the country will peak in terms of cases sometime in the next 2 weeks, and North Carolina will likely follow that pattern. Hospitalizations and deaths will lag behind. Looking at patterns in other countries like UK, South Africa, and Greece, who experienced Omicron earlier, they saw a rapid uptick followed by a decline with a cycle spanning 4 to 6 weeks. The sheer size of this surge continues to cause a tremendous strain on healthcare systems throughout the state. Our system has over 330 patients hospitalized, although proportionally less requiring ICU and ventilation compared to prior surges. Our test positivity rate locally is 36.2, and with symptoms, 47.9. On campus, ending January 16th, there were 528 new cases among students and 186 among faculty and staff. There continues to be a high number of employees testing positive. As we know, vaccination with boosters is the best way to protect against serious disease, and 85.5% of our faculty and staff have received a booster. Masking and testing also remain critical tools in mitigating strategies. As mentioned last week, tighter fitting masks such as N95s and KN95s offer a higher degree of protection with Omicron than cloth masks. And 3-ply surgical masks are also protective and even better when worn with an overlying cloth mask, giving it a tighter fit. This week, Duke has been distributing KN95 masks to our students, faculty, and staff who are on site. These masks can be worn over many days, if not visibly soiled, and if they still maintain their tight fitness. This week, the federal government announced plans to give out 400 million N95 masks for free through pharmacies, groceries, and community health centers, and will start shipping masks to these outlets beginning this week, with some masks available early next week. As you know, it's been challenging to find at-home tests. The federal government this week also began offering residents in the United States one set of 4 at-home COVID tests free of charge. 1 million tests will be available. These rapid tests can provide results within 30 minutes. So visit special.usps.com to place your order through the United States Postal Office. I visited that site today and it took less than 30 seconds to fill out. In closing, we might be seeing some messy weather today, so please be safe out there. Thanks to all our faculty, staff, and students, and to our colleagues in the health system and across the campus for all of your commitment to protecting yourselves, your loved ones, our healthcare workers and our community. I'll be back soon to share updated information.